Hello, Nurse 306. This is APkurdila. I'm going to be going over my professional practice model summary and critique. I selected Stanford Healthcare as my professional practice model. I selected them because Stanford is equated with excellence and prestige in terms of academics. So I wanted to see if there was something I could glean from their professional practice model to incorporate into my practice and to better care for my patients. So to start out, the facilities within Stanford Healthcare are located in the Bay Area in Northern California. So that's the San Francisco Bay Area. Stanford Hospital operates in more than 60 clinics in the Bay Area and beyond. Stanford Healthcare is a new hospital that just opened up. It is located between San Francisco and San Jose. It's a level 1 trauma center, and it has 605 beds and 87 operating rooms. In terms of the specialties, they have multiple specialties, and I'm going to go over the ones that are nationally ranked. Their cancer department is number 25 in the country. Their cardiology and heart surgery is number 10. Their ear, nose, and throat is number 8. Their geriatrics is number 17. Their gynecology is number 9. Nephrology, number 17. Neurology and neurosurgery, number 9. Orthopedics, number 9. Pulmonology and lung surgery, number 31. And urology, number 32. So as you can see, they are nationally ranked on multiple disciplines, and there is much that we can learn from them and how to provide excellent patient care. So in terms of the professional practice model, their professional practice values are honesty, excellence, advocacy, respect, teamwork, and compassion. So I'm going to go over each of these values individually. So honesty, their definition of honesty is truthful and open exchange. Excellence is doing their best at all times. Advocacy is acting in the best interest of the patient. Respect is consideration and appreciation of others. Teamwork is working together in a spirit of collaboration. And compassion is kindness and caring for everyone. So, in addition to these values for the professional practice model, the system also operates on a shared leadership mentality, and they have a shared leadership council which empowers staff members to implement the strategic plan for patient care. Members of the council address such items as professional operational issues, ensuring patient safety, and then the coordinating council coordinates, integrates, and monitors the activities of the council and can mediate issues between them. So they provide an oversight to the councils and help to settle disputes between them. So that's how the Stanford Health Care Center, how they embody governance and how they embody leadership. For facilitating professional development for their staff nurses, the healthcare system has a Magnet and Professional Growth Council, which supports professional achievement and role development. They also recognize staff contributions and optimize recruitment and retention of clinical staff. So now I'm going to go over my critique of the professional practice model. It's a very brief model. It's only those 6 values. So there's a lot of ambiguity as to how to actually implement those practices. It gives the definition, but it's up to the nurse to then implement them. I would have liked to have seen more patient scenarios and how the situations a nurse may encounter, which would, and how they could, operate honestly, or operate by advocating, or operate with compassion. What are some examples in terms of the common situations that nurses face? So in that sense, it's a bit bare bones in my opinion. It does provide the values, and it has to be general and broad because it has to apply to multiple disciplines, and it has to apply to outpatient, inpatient, and all different types of settings, surgery. It does not include protocols or situations such as hypoglycemia or a patient coding. how do you operate honestly with a patient coding? What is the protocol on your specific unit? And this could easily be departmental based, and a nurse would need to refer to their departmental guidelines in terms of the steps to take to operate with honesty. For example, how would a nurse operate honestly if a provider orders a medication, but she, in her clinical judgment, that medication is not indicated or could actually harm the patient? How does she operate honestly? She would then, telephone the provider, giving her assessment of the situation, and the provider would hopefully withdraw the medication or provide a sufficient explanation as to why that was ordered. So this this professional practice model offers a mentality that all staff need to operate, excellence at all times, advocating for the patient, but it doesn't give the nitty-gritty or the specific details for specific situations. And that is my main critique of the model, is that it's very general and broad. Another weakness of the model is in terms of how it specifies providing holistic patient care. These are values which can help the nurse to guide his or her practice, but they don't provide the ways in which one can operate with compassion or honesty with patients from different cultures. I would have liked to have seen how you provide examples of providing holistic care and providing culturally sensitive care for a patient. For example, if you're taking care of an Asian patient, especially in the San Francisco area, because they do have a multicultural population, including many Asian Americans. So if a patient from an Asian culture comes in and they're sick and they have the value that heat and cold help to modulate illness and health, and they feel that if they're diagnosed with this certain condition or illness, they're going to need a cold or a hot beverage to help improve their condition. The nurse would be operating holistically if they gave that to the patient to help them cope with their illness. And regardless of whether or not the nurse feels that this is a effective treatment, it doesn't matter. It doesn't matter if the nurse feels this way. It matters what the patient feels like. And that's how we provide holistic care, by incorporating the patient's values. We provide our care medically, but the patient comes in with their own set of beliefs and values, and we have to respect those, as long as it doesn't compromise their safety, of course, or the safety of other patients. The model, in terms of providing holistic care, they didn't detail anything about a language line, and I think the language line is really invaluable to my role as a nurse. I mean, I've communicated with patients from Hispanic cultures because I don't speak Spanish, and I was able to address their needs and perform all of my assessments and care, assess their pain, and list out their medications and all the other various activities you do as a nurse throughout your shift. And I wouldn't be able to do this without the language line. It wouldn't have been possible. I'm not prolific in speaking Spanish, so this is really an invaluable tool, and in terms of providing holistic care and culturally sensitive in a culturally sensitive manner. And in terms of providing holistic care, they didn't include in their model how they're providing holistic care and how their care is superior to other hospitals, or what they're doing to go above and beyond. So I was a bit disappointed in terms of that. There wasn't much difference between the practice models of my own hospital and my hospital. Roanoke Memorial Hospital is one of the top in the state. So a lot of the same things, magnet accreditation, things like that, were very similar from my hospital to Stanford's, which is reassuring. But I would have liked to have seen Stanford, because of their prestige, to see something a bit more in depth. In terms of promoting decision-making for the patient, family, and the interdisciplinary team, in the model there is an implicit assumption that the nurse should incorporate the family in the decision-making process via the values of compassion, respect, advocacy, and honesty. The model does not address decision-making in patients that are confused or lack capacity. It does not address decision-making powers, a power of attorney, or a medical will. There is a lack of specifics in terms of navigating decision-making in complex patient situations. I think this is another weakness of the model, just offering those vague general guidelines. I really think that there should be more nitty-gritty and more specifics in how how a nurse should operate in these situations.